This is Dr. Evangeline Obi with Ministry Wellness Center and Maya Fine Corporation. I'm here to talk on diabetes. What is diabetes? Diabetes is excess sugar in blood. It is diagnosed when your doctor checks your hemoglobin A1C. It's a blood test and it's amount of that is glycosylated. When that is checked and it is 6.5% or higher, then that is diabetes. Normal should be less than 5.7. When it is 5.7 to 6.4, that is pre-diabetes. Depending on other factors, your doctor may put you on medication earlier, but diabetes diagnosis is when it is 6.5 or higher. And also diabetes can be diagnosed when there is a finger stick, fasting blood sugar check through a finger stick. And if that is 126 milligram per deciliter or higher, then that is diabetes. It's usually checked at 2 occasions. Usually the person is symptomatic with symptoms of diabetes. The third way of diagnosing it is doing oral glucose test, which is where you're giving a glucose solution to drink, and then your blood sugar is checked. It could be 1 hourly times 3 hours, and depending on the numbers, you can be diagnosed. Usually we want it to be less than 140 milligram per deciliter. Hemoglobin A1C is the most commonly used method of diagnosis. The person doesn't have to be fasting to do the test, and the test is done and it's accurate in diagnosing diabetes. Symptoms of diabetes could be what we call the 3 Ps, is a common way of remembering it: polyuria, polydipsia, polyphagia. Polyuria is peeing frequently. Every so often you're going to pee. Polydipsia is drinking a lot of water because you're thirsty, you're drinking, you're peeing. And polyphagia is eating a lot. You're hungry, you want to eat, and you're craving sweets. These are the common symptoms of diabetes. Other things are neuropathy, numbness in your hands and feet, blurry vision. I've seen patients come in, they say they can't see, their eyes vision is getting blurred, they think they're going blind, and you check and their A1C is like 12 or higher, very diabetic. So diabetes can affect the whole body, or you have non-healing wound because of the high sugar in blood. It impairs wound healing. So these are things you watch for to know that if you're diabetic. Some risk factors for diabetes are weight. If you're overweight, your body mass index, the BMI, which is ratio of your weight to your height, is 25% or higher. Have your doctor check for diabetes at least once a year or every 2 to 3 years, depending on how rapidly you're gaining weight. If you have a first degree family history of diabetes, let your doctor also check for diabetes. So diabetes is a common disease. Over 1 in 3 people are more likely to be diabetic or pre-diabetic. So make sure you are checking your blood sugar and knowing that you don't have it. Because what can diabetes do to your body? If you don't know that you have high sugar, it can be putting stress on your blood vessels, your nerves, your vital organs like your eyes, your kidneys, your heart, your brain start struggling because of the excess sugar. Things that can also raise blood sugar are not just what we eat, but also stress. When there is stress in our life, we're so stressed in our thinking, in our activity, in our job. When you're stressed and not sleeping well, poor sleep puts stress on your body releases stress hormones like cortisol, which increases sugar in your blood, and then you start to struggle, your body starts to struggle. So make sure there is no stress, that you're eating well, staying active, staying fit, and sleeping well and not stressing. Make sure you avoid stress as much as you can so that you don't have diabetes. And some of the complications are, like I said, poor vision. So make sure every year, if you're diabetic, that you check your vision for retinopathy, that you check your kidney with a urine test called a urine microalbumin creatinine. Make sure your kidney is okay. that you don't have neuropathy that can affect your foot and your extremities. You may have a non-healing ulcer in your leg and not know it. So make sure you see a podiatrist and get to know how to take care of your feet. Also, your heart is okay. Get your doctor to do blood tests and make sure everything is fine. Diabetes, when we treat diabetes, it can be treated with oral medications or insulin, injectable medications. There are newer medications which help treat diabetes and also help people lose weight, like the semaglutide. So talk to your doctor about that, especially if you're obese. This medicine, you inject it once a week. It's easy to use. It helps control your sugar and also helps you lose weight. So diabetes is just something you don't want to play with. Get checked and get treated and know your numbers so you can better take care of yourself. This is Dr. Evangeline Obi with Ministry Wellness Center. You can reach us at info@ministrywellness.com. Thank you. Bye-bye.